So again, welcome everyone. My name is Kim Whitmore. I'm an assistant professor in the School of Nursing at the University of Wisconsin in Madison. And I am, along with my partners, leading an effort called the Break Exchange, which stands for Building Respite Evidence and Knowledge. And we're really trying to connect people who are involved in respite care around the globe to help better understand best practices and connect people to researchers and evaluators to improve the evidence base of respite care around the world. And so if you're not familiar with the Break Exchange, we definitely would encourage you to learn more, and we can send more information out. But this webinar is a part of our series of webinars that we do regularly. This is sort of a special hot topic one because of our current COVID-19 pandemic that is going on. And so we're really grateful to be able to offer this really important conversation and share some great resources that have been developed by one of our partner organizations. So the plan for today's webinar is we are going to hear from Val Madsen, who is the Training and Development Specialist with Respite Care Association of Wisconsin. And she's gonna just walk us through a really incredible resource that she has put together that's available for free on the Respite Care Association of Wisconsin's webpage. And then we're gonna have time after that for questions for Val, and then a more open discussion if people have other questions or comments about how the COVID-19 pandemic is impacting their work to provide respite care and caregiving supports. I do want to call your attention again to the survey that we have going on. I did post information early in the chat box. So if you scroll up to that, you can see a description of the survey. It's the Supporting Caregivers During the COVID-19 Pandemic survey. There's a little blurb there and a link to the survey. We are trying to get people to fill that out as soon as possible because we'd like to turn that information around quickly and share it back out with everyone so that people can learn from others of what's working and understand this impact that's going on. So I would encourage you to take that survey and share it with others so we can try to get as many people responding to that survey as quickly as possible. So again, I see many of you have already posted in the chat box a little introduction. To save time, we're not going to go around on the video call to introduce everyone, but would ask that you would post a little bit of introduction in the chat box for people to read so that we can have reference to that. And again, if you're not already on our email list and would like to be, please include your email in the chat box so that we can make sure to add you. So without further ado, I'm going to pass the screen share capabilities over to our guest speaker today, Val Madsen, again, who's the Training and Development Specialist from Respite Care Association of Wisconsin, and hand it over to her. So Val, it's all yours.
All right, great. Thank you so much for having me. I wanted to share a little bit first about what Wisconsin is doing with the COVID stuff. Most of this is related directly to Wisconsin, so this part will be pretty short, but just to share kind of what our plan is. So our free training, which we'll go through, which is a really great resource. We also have online a respite care certificate program, which is basically kind of a respite 101. We have a lot of people that are using kind of non-traditional respite providers and want some basic information to be able to give them. This is also a free training. It is open to anyone. Some of the sections are specific to Wisconsin statutes, so especially looking at like the abuse and neglect section, but it's a great resource. If you have someone that's now providing in-home respite or respite in a different way that hasn't had experience with it before. So it is a program that we have available on our website. So I just want to share that with you quick. That is all the topics that it covers. So we try to cover kind of all of the different things that might come up for respite providers. We have a registry that's specific for Wisconsin. We are actually updating our registry currently where, this is the profile. We're adding features where you can specifically say if you would be willing to provide care during this coronavirus pandemic. So then that way people are able to search for people who are specifically looking to provide care now. It is searchable by county in Wisconsin. So that is something that we're expanding and offering out to people. And then the other thing we have is a caregiver respite grant program. A lot of our funding sources in Wisconsin are not providing funding for in-home respite care. So we are looking to fill that gap a little bit between when someone needs respite and when their plan might be in place. So let's say myself as a caregiver ends up getting the virus. I need someone to step in temporarily until my big plan is in place. And so we're really looking at this grant program to fill in that section, that kind of short-term crisis area while people are trying to figure this out. So those are the programs that we have specifically for Wisconsin. But let me show you some of the other cool things we're doing. On our website, respitecarewi.org, there is a link on the front page to Finding Your New Normal. And that's basically a bunch of resources that we put together. So when you go into it, it's hosted in our learning management system. And it is a really great opportunity to be able to, there's so much information out there. This was a way we were able to put it in one spot. You can go through it like a typical course where you hit like the next button and it goes to the next page, or you can use this drop-down menu here and be able to skip to whatever sections that you want information about. So it's really a way, some of these sections will apply to everyone, others won't. So it's figuring out what you want and what you need or what information works for you. The other thing that's great about this system is there's this shared files button. Any of the PDFs that we have embedded, you can get right here and download it for you. So for example, in this first section, there is information about a social story for kids about COVID-19, and really could be for anybody. So it's a document that goes through the virus. What is it? What does it mean to socially distance ourselves? You know, all of that information. And my internet's kind of hit or miss right now. So it's slow to load, but what's happening, what it means, will everyone get sick, all of those things. So you can go up here, and this is organized by section. So section 1, you'll find any of the PDFs from section 1 right here. So then that way, if you want this one, then you can just go up and click on it, download the PDF, and use it however you want to use it. There's some information in here that, like this person did not want her PDF shared, but she was okay with it being linked. So the website is embedded into this training program with the link right here. You click on that, it takes you to the PDF, but I couldn't put the PDF right into this program. So there's lots of different social stories depending on kind of what you're looking for. There's a video one. This one's a really great resource that I'm sure some of you have seen. It's information specifically for adults with disabilities that was created by adults with disabilities. So really looking at what it means to have COVID, what if you get sick, what do you do, how do you stay healthy, kind of a great way just to get that information out in a very easy to use system. So the first section is all about explaining COVID-19. And then I don't have my chat box up, so I saw some new things coming across, so I just wanted, awesome. So the second section is...
I'll if there's any comments or questions from the chat, I'll monitor that and come on and let you know, so you don't have to worry about that.
Perfect, thank you, Kim, I appreciate that. This next section is more about social distancing, the stay-at-home orders that we have and what that means. Some of this stuff is Wisconsin specific. So on 3/24, the state governor had issued these orders. So these are specific to Wisconsin, but a lot of the information is more general as well. There's different fact sheets for different types of families. So this one is specifically for grand families and multi-generational families. So information about, again, COVID and social distancing and what that means. Guidance for caregivers, taking care of people with dementia, I believe is this one. Nope, this is just general caregivers, you know, creating a plan, those types of things. Shelter at home and what that means. You know, and I try to put in a variety of information, whether it's lots of words or pictures like this. Again, use what makes sense for you or the population you are working with. But I just try to put it all in one spot. The second part of this is tips and tools to use now that you're sheltering at home. So in here is a link for a home alone course that UW Extension has. That's a really great course to prepare children for being home alone for part of the day. That's available anytime, but again, a good resource. Talking about a routine and then giving some examples. So talking about different tips and tricks that way. How to stay socially connected, and then some stop signs that some families might want to put on their door so that nothing comes in. Again, different parts of the country are in different steps of their social distancing or quarantine. Again, these are in the shared file, so if you look under section 2, all of the stop signs are here so that you can get what you need. Section 3 goes into specific disability and learning resources. Again, some are specific to Wisconsin, others are specific to U.S. Department of Education. But what it means for IEPs now that we're learning at home, and what is really available or not available, or what the government is able to provide. This is new for everyone, so they're still trying to figure it out as well. So again, just more resources for people to have. There's also information in here, links to sites specifically for special ed that might be really great resources. Anything that's highlighted yellow is a link to another page. This I found as a really great resource. It has lots of visuals. So if you're working with anyone that needs some visuals, this has a lot of those things that you can print right at home and have them right away for you. You know, positive reinforcement, just lots of things. There's so much in here. And what I saw, it was all free. So just available for people to have. In this section also is some like OTPT, speech and language activities, you know, kind of very basic, but something to get you through. Again, I know each school district, each state, each city is doing different supports. I know in my town, the special ed teacher is working one-on-one with families to figure out what they need versus doing the online learning that the rest of the school system is doing. So that's there. There's this link here that people want to connect people with special needs to teachers or therapists. So you can fill out this form to be connected with someone that can support you. So I put that in there. So that's the third section. And then the next 3 sections are activities specific. So really looking for activities for filling the time. You know, links to activities for children is this first one. So there's lots of different things out there. People are doing a fantastic job just sharing information and really trying to get people involved. There's more stuff added every day. I'm trying to keep this updated, so I'll keep adding new things. There also might be some things in here that are more PDF, you know, activities that are in here that you don't have to link to others. In the next section, activities for adults, there's some logic puzzles, so that might be more appropriate for different, a different age group. It's slowly opening. but just a wide variety of logic puzzles for people. It's there it is. So that's a great resource. Again, you can go up to shared files and download it and print it off so that you have it right there. Also in the adult section, there is this activity resource booklet that was created by a therapeutic recreation specialist about different activities and adaptations for activities for adults with disabilities. And so it's a wide variety of things that can be done either in nursing homes or assisted living or within the house itself. But again, just another great resource, so that information is in here. The final activity section is activities of any age. So this has a lot of information, again, divided by category. But then down here, there's some big lists that have everything, that list all the online event times, all of those things. Again, just trying to put it all in one spot so that it's easy to use, easy to find. Some non-screen activities, again, just information. Feel free to take whatever you need to for the caregivers that you are working with or for your programs or for yourself. Section 7 is looking at connecting with families in assisted living or with dementia. This is a fantastic video. So the video is embedded right in about how to talk to a family member who might be in an assisted living home and isn't able to have visitors anymore and isn't understanding what's going on. You can click share the link and then you'll be able to get the link so you don't have to watch it in here, and you could share it that way as well. That was section 7. Section 8 goes into some health self-care, making sure that you're taking care of yourself. This mental health first aid is a great website that really talks a lot about mental health, caring for your anxiety through COVID-19. So again, just some really great links to make sure you're taking care of you. There's some different infographics, figuring out how to shift your mindset, because unfortunately we are going to be in this new normal for a while. So figuring out how to get through it and stay mentally healthy. Figure out what you can and cannot control. You can drive yourself nuts trying to control things that are not controllable. So making sure you focus on what you can control so that you are staying okay and that you're making it through this. We are actually working on another training similar to this that is specifically about self-care. I'm hoping to have that out in the next week that has more worksheets. So it'd be more like a guided training to go through. So hopefully once that gets out or is finished, I will add that into here. The last section is looking at using in-home care workers and how to stay healthy, how to stay safe with those providers. Some people are choosing not to have providers in their home, but some people still need to have someone come in to provide care. So this website has some free webinars on really making sure that direct support professionals are being taken care of. So that has been updated, and there's 2 new ones here that weren't there at the beginning of last week. There's also information about, here's another one with courses specifically for standard precautions and COVID information. So all you have to do is sign up here and you get the free course materials. And then there's another link that has 27 different courses, all different lengths of time, anywhere from a couple minutes long to 30 minutes long. About 6.5 hours total of free training that's available out there specifically for this time. So that's thinking about loading, but that's in there as a resource for you to find. There it is. So then in here, it has a wide variety of courses that really talk about anything that you would need to know or want to know. And again, they're kind of a wide variety of times. So that's a great resource. So that's it for this course. We did create a new worksheet yesterday that I will be adding into this section. Looking for caregivers, what is your plan? So what happens if you become infected? What happens to the person you're taking care of? And start thinking about that plan now. Or what happens if the person you're taking care of is infected? And what's your plan to get through that? So here, it just, who are the people that I'm going to call and what is their role? Living situation, if you're sick and you're quarantined at home, what does that do for the person you're caring for? Where are they staying? How are you keeping separate? How are you making sure that the virus isn't passed from one to another? And then thinking about anything outside of your home that you are responsible for. And just trying to make everything in one spot here so that you're able to have a plan ahead of time so it doesn't become panic mode if you do become infected. And then if the person you're caring for becomes infected, who are those people that are part of the plan? Again, looking at your living situation, but then also items and supplies you will need. So is that, because if someone you're in contact with gets the virus, you have to self-quarantine. So who's gonna do the grocery shopping? Who's gonna get you medications or supplies that you need? Do you have access to face masks or gloves or other personal protection, hand sanitizer, all of those things. So trying to have people think about it now versus waiting until it happens. So that worksheet will be added to the program as well, as we just came out with it today. So that is what we are doing and the program that we have. So I guess I'm ready to open it up to any questions or comments or anything like that.
Thank you so much, Val, for sharing this incredible resource. I know that she went through that really fast, and there's so much more in there that she wasn't able to highlight. And so I just want to, thank Val for all the time she put into organizing this great resource. And again, I did post a link to this resource in the chat, so you can go find it and explore it and share this with others. So if anyone has any questions or comments for Val, you can unmute and chat, and if we get 20 people trying to talk at once, then I might facilitate that differently.
Am I muted, Kim?
You're live, Janet. Hi.
Oh, hi, all of you. So nice to see you all. Sorry, did you just hear my phone? Hi, Maga. Hi. Did you just? Oh, Cassandra. So nice to see you, Loic. Look. Oh, so lovely. Hi, Val. Did you just, sorry, did you hear my phone ringing? I'm so sorry if that interfered. But anyway, I just think that is extraordinary, Val. That's absolutely amazing. I don't know, where is that link, Kim, so that we can get on it? Did you say you've sent it to us?
Yep, I put it in the chat box. I will also, when we send out the recording of this, I'll put it in the email as well. I will
okay.
copy it and send it in here again, so it's right at the
It's so comprehensive. I would like to share it with our national network of parent carer forums, if that's okay, Val.
Oh, for sure. Yes, get it out there.
It covers everything. Yeah, it's brilliant. Thank you so much.
Oh, thank you.
I've only got praise for it. It's absolutely awesome.
Oh, thank you.
Way to go, Val.
Thank you. I'm thinking the same thing. This is Cassandra. I'm blown away at how you got that together in such a short period of time, because we're frantically trying to get materials together, and I'm about to send an email to all my colleagues saying, here, they've done the work for us. So thank you, Val.
Oh, good. You're welcome. Yeah, please use it. Please pass the information out. If you find anything that's a really good resource you think should be included, feel free to email me. I'll put my email in the chat box as well, because I'm adding new things from people all the time.
Fantastic.
This is Thomas. You are all are lucky ones. You know, I've got the language barrier.
Thomas!
So
Hi!
I have to translate everything within 2 weeks. Oh. Wonderful thing, really great. I would love to have it in German.
Yeah. Oh, Thomas, you've got to translate it. Oh, that's bad luck. Bad luck.
Anyone else with any questions or comments for Val?
I just had one thing to say, Val, and I came in a little bit late, so I don't know if you had, it's such a comprehensive document, but one of the things I know that we're doing here is making sure that families who want to self-isolate, so my area is families with children with disabilities, so families who don't want their children to go to holiday play schemes, we've got Easter coming up, who would prefer to self-isolate and say, no, that's okay, we want to keep our kids at home. We're using the sorts of programs that you showed. We've set up a key worker scheme. So those families have a named contact. So that contact phones them at least once a week. So we did a risk assessment on the most vulnerable families. So children where there may have been safeguarding issues, there may have been domestic violence, there may be more than one child with a disability, low-income families, all the obvious things. They've got a key worker who phones them and just checks in with them. I don't know whether you had that in, it's such a fantastic document, but just having a point of contact for some families I think is very valuable.
Yeah, no, that's a great idea. And how our system is set up in Wisconsin is a lot of those families have a caseworker that is doing the check-ins. Yeah. But that's a great thing to add for people that might not have a caseworker, that might not be connected to funding sources that have that point person. So that's a great thing to add. Thank you.
Yeah. So we've done it with, sorry, Cassandra, we've done it with teachers. So as the schools close next week, we've asked a lot of the teachers who are being asked to, you know, do some work over the Easter holidays to take a list of families. So they're at home with their own families, but they've got a list of vulnerable families to phone. So there's a point of contact if, you know, if things go belly up, and the longer it goes on, there's more chance of that with our vulnerable families.
Oh, great, thank you.
May I speak? One of the struggles I'm having as a full-time caregiver is I have one person I receive respite from, which is wonderful, but I do need 24-hour help. And the two informal caregivers that I could be using live in Seattle in the thick of it. And one was a teacher at a school where there were cases. And my issue is they don't, because neither of these young women are showing symptoms, they can't get tested. I don't want them in the house unless they've been tested. I'm just wondering, is there a, I think I might have lost everybody. Is there a mechanism for advocating for providers to get tested for this situation?
That's a great point, Cassandra, and I think a probably global question. I think right now, at least in the US, testing is limited. Our ability to test people is pretty limited. And without symptoms, I think that might be a hard sell to do that. My recommendation, what I've been recommending to people that I know who have vulnerable people at home is, you know, to have people that are coming in and out check their temperature at the door and, you know, monitor temp, because that's really going to be one of the first signs that they are infectious, and, you know, try to rule that out. And then just really good, you know, universal precautions on hand sanitizer, gel, cleaning. And if you don't have access to gloves, masks, and hand gel, just good old-fashioned hand washing and covering your cough is, you know, going to help protect you probably as best as you can in these situations. I know that's a huge concern for a lot of our caregivers in Wisconsin, and we're actually going to be convening a group to look at writing a grant proposal to try to get personal protective equipment into our communities to help with situations where there is caregiving support and respite care, and making sure that they can get those supplies because they're so limited right now. So we're trying to figure out a way to get those supplies and set up a distribution system for our community support people in Wisconsin.
Yeah, I'm at my sewing machine making masks. So when I
oh, no surprises, Cassandra. Way to go. You go, girl. I'll buy some. Wonderful.
Any other questions for Val about the great resource she put together, or comments from anybody? Great. Well, thank you again, Val.
How long did it take you, Val?
Oh, Colette, how nice to see you.
Hi.
Hi. Looking lovely as always.
Val, how long did it take you? It's huge, the amount of information. Very impressive.
Oh, thank you. No, I actually put the bulk of it together in 2 days. So I cranked it out. No, I put the bulk of it together, but so much is on Facebook in particular. So I would just start saving links, and then I had my categories and just started moving things into categories because it was so overwhelming. I think that's where I struggled with the most, is figuring out a system to go through the overwhelmingness. And once I figured that out, it was actually pretty simple for me to move it in. The software we use to set it up is a software we're already using for our online courses. So we already had the tool in place. It was just putting the information in there. So but then adding it to, you know, we kept adding more things over the last week.
That's great.
So you've only just started, Val.
We did, yeah.
So
Yeah,
you're going to get better and better.
Yeah, so it's only about 8 days old, so it's still a newer resource. So we're still adding and expanding it, but I don't want it to become too overwhelming either, because if you have 90 social stories to go through, that's not a helpful.
No, you're right. You're right. Yeah. Yeah.
Yeah, I think that's great. And again, a reminder to everyone that if you have resources that you found that you think would be helpful to put into this great collection, please send those directly to Val, and we'll make sure that, you know, she'll review them and make sure she has the best resources in there to not overwhelm people, but to get them out to folks. And I know for many of our international partners that are on the call, the language might be a challenge, but it might give you some ideas of areas to look into to identify or develop resources in your own language. So hopefully it's helpful to you as well to have this as an example of what might be helpful support resources to provide in your own home countries.
Are there any plans to translate this into Spanish? Because that would be the main language we would need it.
There isn't on my end. That's something as a organization, Respite in Wisconsin, that we've been talking about is translating our trainings into Spanish, but it's not something we're up and running with yet, but it is a conversation.
And we have, with friends, we have parent leaders who are bilingual, bicultural. If there were a few, I'm going to go through it, and if I find a few key ones, I might ask for them to do a translation. It wouldn't be it wouldn't be approved by ACF or anything like that, but I would have something. So that's, and then of course great. I'll share it.
Yeah, that's fantastic.
But any other languages, I heard German, and I heard Thomas say he was going to do some translating, and I think we have a few French folks on the call. So any languages to share would be very useful.
That's Cassandra. Thank you for bringing up that question and concern. I just want to make everyone aware of a separate initiative that I'm involved with through the University of Wisconsin. We have a interdisciplinary group of researchers who are working with our Wisconsin League of Municipalities, so representatives from all the different cities and counties across the state, to develop evidence-informed messaging about COVID-19 and pushing that out to the communities. And we are very conscious of the language barriers in that. So we are pushing out. Our initial survey went out in I think 6 different languages, and our messaging as we're developing it, we're trying to translate. And so if you're interested in following the work of that group, we have a Facebook, Twitter, and Instagram account, which I'll put in the chat box, and it's called Do Your Part. So we're really trying to use the evidence we've gathered from the survey and working with experts in behavioral psychology to develop messages that may actually help resonate with different groups to try to help promote good practices in the community across different sectors.
I think that part that referred to the mental health, about what you can control, and what you can't control really rang true to me. You know, I've been visiting some old people in our community today, and the how scared they are about what they can't influence and what they can control. And exactly, Val, what you've got in that, you know, in that guidance, just work with what you can influence in your day. So this is what you can influence. Don't worry about what you can't influence. That all of that stuff for mental health is so important, and I think is going to become increasingly more important as everybody becomes at different times more stir crazy, basically, just to put it crudely, and is affected by the fact they can't get out, they can't see their families. You know, it's a very, very difficult thing for humans to get their head round, because we are pack animals, aren't we? We want human contact. I'm looking at all you guys and thinking, oh, I'd love to give you all a hug, say hi. So it's a virtual hug, but we are pack animals, and I think the mental health bit is so important.
Yes, and well, and I think especially as we go on, not knowing when the end is going to be the hardest thing for people.
Yeah.
Not knowing, are we doing this for a month? Are we, you know, in Wisconsin, we're on week 3 of social isolation, you know, so I know different people are at different stages, you know, is it for another month, or are we really talking about August or September before?
Yeah.
You know, so I think that's one of the, and that's something I can't control.
No.
And so figuring out what you can.
Yeah.
Yep.
It's
yeah, great comments.
Yeah.
Excuse me, I just have one question. Are you going to get it in Icelandic also? No, it's a, we need to have some, you know, for the conference, because people have already chicken. And they can get the money back if they, okay. Is it bad? Is it okay now? Do you hear me?
You're in lovely light there, Magda, and I'm very pleased to see that standards haven't fallen and you have your lipstick on.
Yes, it's very important, you know.
Yeah, you look.
Everything is in mess. My son went there. It's, you know, the breaking the water pipes, you know, the water is floating all over, so it's a really bit stressful. I'm just asking because the people who wanted to come to Wisconsin this summer have already bought a ticket and asked to change it if you have a date when you think next conference will be held, Kim.
Magalisa, you cut out a little bit there, but I think I understand your question.
That's just because I'm Icelandic.
Magalisa, our amazing friend from Iceland, is asking about the International Short Break Association conference that we were planning to hold in Madison in June that has been postponed. And her question was about if we know the new dates, because people are looking to rebook their travel and determining what they need to do. And the short answer to that is we don't have confirmation from our venue yet on the dates. We are looking at dates in next June, and we're hoping in the next week to have a more definitive answer, but nothing confirmed yet. Great. Okay, so we do have a few minutes here that, again, if there's no additional questions for Val, I wanted to open it up just to hear from people if there's anyone that has something that's working really well, something they've done or adapted to in the services they provide that they'd like to share, just to create a space to share what's working and best practices. So if there's anyone that has something from their part of the world or locally here in Wisconsin that you want to share with others, an idea for consideration, we'd love to hear from you.
Kim, mine would be the key worker. I won't say it again, but it's that key worker and that contact with the families. Very straightforward, I know, but that's I know something that is really making a difference to a lot of families locally.
Right. Thank you.
I think that's true, and I think that a key worker can be a whole variety of different people. It may not be the people who are normally key workers, but other people in the system who perhaps have particular skills, depending on, you know, the child or the adult who's being cared for. And Harrod, hi, and Harrod.
Harrod.
Yeah, remember Anne Harrod from Galway?
Yeah. Where is she?
She's at the bottom of the screen. We can't hear her.
Where are you, Anne Harrod?
I think she's...
Anne Harrod, unmute, unmute. Because Anne Harrod is coordinating a program in which... No. Ah.
I think her audio is not quite working right. So, and Harriet, if you want to post in the chat box, you can message us that way as well.
I'll try now. Can you hear me now?
Oh, there she is.
Wonderful.
Hi.
Hello, everyone. How are you?
Hi, Anne Harrod. Lovely to see you.
And you, long time no see. I was really interested to hear what was being done, especially all the resources that Valis has created. It is amazing. And I think in terms of where I work with Ability West in Galway. And I'm a home sharing coordinator, so I support short breaks for people, children and adult disabilities. So there's a lot of resources there I can definitely forward to our families. But what we're finding at the moment in Ability West is that we're really trying to manage the current outbreak by limiting the amount of non-essential services. So we're really kind of prioritizing what's essential and maintaining those. So we've really skimmed down. Day centers have closed. A lot of community support, in-home support has stopped. Even a lot of home sharing families have suspended their placements, and centre bite respites have reduced capacity to allow for physical distancing. And at the moment, everyone's been really amazing and the families are being wonderful. But my main concern is how long can we manage doing this? And that would be my concern. What's going to happen now in a month or 2 months, or as you suggested, if this goes on until August or September? I'm really concerned about the longevity of this.
And then I think if key people end up becoming ill, I think at the moment, for most of us, we're lucky enough to feel it's a little bit out there. But once it comes into your own family group, or once it becomes, you know, part of your support system is affected by it, it's going to change the dynamic considerably. And it's very hard to know how we can prepare for that. But I think we need to look at how we can prepare for that. Yeah. And I think, Val, you know, your tool in terms of determining what if this thing happens or something else happens, that we probably need to be doing it. It's quite challenging because, you know, part of being human is that we would prefer to think, well, it's not going to change any more than it has already, but we need to face up to that.
Yeah, I think that's a good point too, and kind of an opportunity to rethink other ways to provide respite in this situation. So I think it is an opportunity for us to get creative and innovative about how do we support that relief from caregiving without having a physical respite service and support. So I think it gives us a true opportunity to look at some of those alternative types of respite and promote those. And so really would be interested in your ideas and harvesting some of those examples that we can push out to share with people as well.
It's probably, a lot of it is about what we're doing in the workplace at the moment, where we're learning to communicate remotely. And in terms of interacting remotely with people and providing input to them remotely, we're not used to doing that with people who use our services. We're used to face-to-face contact, but you know, I think again, it's probably what's happening at the moment. It's very challenging, but it's also going to give us great opportunities to be creative in ways that we haven't had the opportunity to do before.
I think you're right, Colette. I think every opportunity, every situation like this throws up challenges, but opportunities. I think you're dead right. And I also think you're absolutely right about anybody can be a key worker. I really do. And I think it's showing already in the UK, you know, within the local authority, there are jobs that people would have said, oh no, you can't possibly work from home. And they are working from home. So it's showing up, you know, the opportunities for the human race to connect in different ways. I think it's hard for all of us guys because we're so much in the people business and we expect to see people and a person wants to talk to a person about their loved one. But I think it does create opportunities for us. And if we can, like Kim says, pull those ideas together in some sort of resource library, then out of this can be some good for respite and short breaks in the future. Other ways in which we can help each other as a global community, really.
Mm-hmm.
It's amazing how, you know, bureaucracy, like services become extremely bureaucratic.
Yes.
And it can take so long to do the simplest things. Now, all of that has been swept away.
Yes.
You know, it's great. Rather than, you know, sort of have we obeyed this rule, that rule? It needs to be done. Do it now.
Well, I'm back to the, I don't know what testing is like in other countries, but in the United States, it's very difficult to get tested. And yes, I agree with you, Kim, getting universal precautions in your home. And we, of course, have been doing that. But I think advocacy for caregivers, because this is respite for me, just being on the phone talking with you folks. But until we have a fleet of robots who can change feeding tubes and do IV infusions in your home, until that happens, we need human beings and caregivers who do 24-hour care, where it's really a lot of care. I think we need to be able to get respite providers and home health people screened. So I'm just thinking in the United States, advocating for breaking some rules or changing the guidelines so that in-home providers can be tested for this purpose. So, and again, I don't know what it's like in other countries, but as you know, the United States was lagging a lot in terms of being able to test people. So that's my thing, because if I get sick, we're done.
Yeah, yeah.
You know,
I see that. I absolutely see that, Cassandra. It's so vital, so vital.
In Ireland, I think just in the last few days, that has started to feature on the airways. You know, the people, there was a mother yesterday on the news, the national news, and she was describing, she was there with her son, and she was describing how important her role was and what was going to happen if anything happened to her. So there's starting to be an awareness, but it's only at that early stage. At the moment in Ireland, and I think probably in most countries, it's about how can you give priority to testing for your immediate healthcare workers, for your doctors and your nurses. And we certainly are lagging behind on that. We're getting better, but at the moment we haven't quite got as far as the carers yet. It's only just starting to have the awareness now at this stage.
Yeah, yeah. So, same in the UK, same here in England. We're behind. We're catching up, and they're trying to make sure that the people that Cassandra was just talking about, the care workers, because at the moment the focus is on the NHS workers to get them back into the system so they don't have to self-isolate if they haven't had it, or if they have had it, they know now they're done, so get them back. But the emphasis is also now on care workers. You know, that workforce that keeps all of us at home supporting our loved ones. You know, I echo completely what Cassandra said. I'm going to have to go in a couple of minutes, guys, because at 8 o'clock in the UK on a Thursday, we have a national clapathon, and I'm leading it in our road for all our health workers and social care people, and we all go and stand on our front door and clap. And it's the one moment in our neighbourhood when we see each other and wave. So I need to go to the loo, and I need to get some shoes on, and I need to go and get my pan so I can clap loudly for all you health workers and everybody who's keeping the whole world going.
Thank
Janet,
you. That's
you could bring it with you. You could bring it with you.
Yeah.
And we would all.
It's a global clap. It's such fun. Every week it brings tears to my eyes. I don't see my neighbours, and we go in the road for the first time, and we all clap and shout, "Hi, how are you doing?" Because the rest of the time it's all by WhatsApp, so I don't want to miss it. So I'm going to sign off, guys. I'm inspired by you all.
Because what I've noticed is that when people are out walking, because that's all we can do now.
Yes.
And you're at, you're kind of at 6 meters, but people are actually ignoring each other. That's what I'm noticing.
In London it's the opposite. We've spent decades ignoring each other. Now we're all going, "Hi."
Well, we're going the opposite way. So I'm making it my business to smile at people and say hello to people, and we can't go there. We can't go there.
We can't. You all look great, and Kim, I take my hat off to you for organising this. Well done. Love to you all. Stay safe, and I look forward to the minutes. Cassandra, keep on singing. See you soon.
Great.
Bye, guys.
Bye,
Bye-bye. Bye-bye.
So I'll wrap us up here. I think this is just such an incredible conversation. Again, thank you so much, Val, for all the work you've done putting that resource together and sharing that with everyone. We will follow up with the recording and the links to everyone. If you haven't already, put your email in the chat. If you're not on our distribution list already, we'll make sure you get included in that. And again, a reminder that we are continuing to try to harvest good ideas and understand how this is impacting your work. So if you haven't already taken our survey, it's a super easy survey. There's literally 2 questions. How has this impacted your work? And do you have any resources you would share? There's an option to extend that and take our break exchange survey, but the COVID survey is 2 questions. So we encourage you to take that survey, share it with others, help us quickly understand this issue and how it's impacting caregivers, and what we can do to put out better resources and supports and information for all of our partners across the world. So we're really grateful for all of you and the work that you're doing every day to continue to try to help support caregivers and provide respite and short breaks to people, because we all know how important that is. So thank you so much for your time, and wish you all the best, and please stay healthy and sane in all of this as well. So thanks again for being here today.